Hi, everybody. We're back here with Jennifer, and she's a certified lymphedema therapist who is expert on lipedema and lymphedema. And we're going to talk right now about the treatment of lipedema and lymphedema. And without further ado, here is Jennifer, expert educator on lipedema and lymphedema.
All right, thank you, Dr. Wright. So we will get right into it. And so when we talk about this management of lipedema, we really have this multi-pronged approach. It is really aiming to reduce inflammation. We know this is an inflammatory condition. A lot of patients with lipedema have a lot of pain. So really great management can help to reduce some of that pain for patients. We want to improve lymph drainage, as we talked about in one of our other videos, that even in those very early stages of lipedema, patients have impaired lymph drainage. And also a lot of patients start to see this progressive fibrotic tissue buildup, that hardening of the tissue. So management is aiming to soften that fibrotic tissue. So when we sort of look at these different ways to approach this management, course, we want to reduce inflammation. So nutrition is not my area of expertise, but in general, eating nutritiously, focusing on, I think a lot of experts are saying more of a plant-based diet, but for each person, a diet that's going to reduce inflammation might be a little bit different. I don't know if you have anything to add about specific diets for lipedema.
Yes, I think this is very, very important because it really, so we call it an anti-inflammatory, and that's whole foods, essentially limit highly processed foods, again, eating as many healthy whole vegetables, healthy fat, and healthy protein, but really limiting refined carbs. And we find that bread, sugar, pasta, rice, all these highly refined carbs can be really pro-inflammatory and really aggravate the lipedema, pain, swelling. And we're seeing a lot of success with people who can really lean into an anti-inflammatory low carb diet.
And are you recommending any supplements or medications for your patients that come to see you? Are you seeing those being helpful for these patients?
Yeah, so I do. Now, I mean, I focus on the diet and the compression first, but I do recommend supplements. We did a nice study with diosmin, and it really helped with the pain of people. And diosmin, for those who don't know, is it's an extract of citrus peels. It's a bioflavonoid extract of citrus peels, and it's been used in Europe for decades and for venous and lymphatic diseases. And we also have now we did this study on lipedema, and it also helped our ladies with lipedema in terms of pain and tenderness. And then sometimes I will recommend Mucinex, guaifenesin. It's not been well studied, but it may help with pain and tenderness. So
that's great. And then, so you will see that in addition to manage pain, exercise is really important. Now, exercise is going to look a little bit different for every person, depending on what's safe for you, depending on what your pain looks like. Generally, an exercise I say that a patient can stick with and has fun with long term is great. Just walking is great. Getting in the water is really, really helpful often for patients with lipedema or lymphedema. Even if you can't swim, if you can get in the shallow end of the pool and just walk in the water, just being in the water is adding some compression to those limbs. Also, it's just, offloading the joints. So you feel like you're moving a little bit better in the water. So I think that was a great exercise. Resistance training is really helpful. A lot of people with lipedema are hypermobile. And so a lot of people experience pain in the joints. So resistance training can be really helpful with that. That's when it might be great to go see a physical therapist at some point to help with those specific exercises. And then also in terms of improving that lymph drainage, helping to soften that fibrotic tissue, that really firm skin, compression garments are really helpful, and supporting those tissues. Seeing a lymphedema therapist can be really helpful. I'll talk about what that lymphedema therapy could look like on the next slide. And then pneumatic compression, sometimes called a pump, is really helpful for management at home. Do you have anything else to add before I go to the next slide, Dr. Wright?
Well, no, I think and we're going to talk about how we want to get that tissue softer and yeah, and so this is perfect. Please continue.
So when we look at treatment overall, we call this complete decongestive therapy. Really helpful for people with lymphedema and lipedema. And so we can sort of split this into two phases, where phase one would be where you are in the clinic seeing a therapist as many times as possible within a few week period. The goal here is to decongest and reduce volume. The goal here is to get an exercise routine, a routine of self-care, help reduce that discomfort and pain. So this will include typically manual lymph drainage. So this is a hands-on technique that the therapist is going to do to move lymph fluid throughout the body. The therapist may get you in compression bandages if that's appropriate to help move that fluid and keep that fluid from accumulating in an affected area. This is where you'll start to learn exercises as well as skin and nail care. That's really important because that'll help to avoid infections. What's really important is phase two, where maybe you get discharged from your therapist, but because this is a chronic progressive condition, it's really important to be able to manage it on your own at home or with whatever support that you have at home. And so ongoing therapy might include self-MLD, which I'll talk about next, or using an advanced pneumatic compression device. Both of those are a way to move that fluid on a daily basis. Really important to get that protein-rich fluid out of the area to help decrease that inflammation. Compression garments are, again, very, very helpful for supporting those tissues and helping to avoid the accumulation of fluid. Exercise remains really important. So does skin and nail care. So these two phases together are things that you might go back to phase one at some point, throughout your life, because it is a chronic and progressive condition. But it's really important that a patient has all these tools to manage this at home, because it is manageable when you do have the appropriate knowledge and have the appropriate tools.
I'd like to, so MLD is always going to be helpful. Sometimes as far as the compression bandaging and wraps, we do use that, but many of the lipedema ladies do not need the wraps. They're not going to have they're going to have a very small reduction, and I don't know, at some point I'm going to talk to you about our studies with that, but so sometimes they can go straight into just being fit for compression garments, and go not do the wraps. It's variable. Everybody's individual. And then but it's critical, the compression, and they are going to need, lipedema ladies are going to need compression pretty much from their foot all the way up to their waist, and then the compression, the pumps like the FlexiTouch are also very important. And at some point, when you're ready, I'm going to share our studies about that.
All right, perfect. So let's first talk just through some manual lymph drainage techniques. So these are just really basic techniques that I am going to show. These are things that, patients with lymphedema or lipedema can certainly do on their own. I always say, if you want a little bit more information or to do more of a full hands-on drainage session, go see a lymphedema therapist. Really helpful to teach you the full technique. So I'm going to move this back so you guys can see me. All right, for manual lymph drainage, you can start sitting up in a chair, you can be lying down, just get comfortable. Manual lymph drainage is always going to start up near the neck. And so a lot of people think, well, it's my lower half of my body that's affected. Why am I starting way up here? The reason is because when lymph fluid moves throughout your body, ultimately it is going to come back to your heart, up at either your right lymphatic duct or your thoracic duct. So we're really starting up in this area to start stimulating this sort of system to help it prepare it to, receive some fluid from other parts of the body. So that's what we call terminus. And so a couple of ways we can do this, but we want to kind of start right above the collarbone here. You can cross your arms over if you would like. You're going to do a light pressure just right above that collarbone. I'm not pressing down too hard. Our lymphatics are pretty superficial. I'm wearing a little bit of a sweatshirt here. If you can get on bare skin at home, that's even better. We don't want to have any lotions or oils on our hands because what we want to do is we want to get a nice stretch to the skin when we're applying pressure. So what we're going to do with light pressure is we're going to go in small circles just above the collarbone, keeping that nice light pressure. We're going to do this about 5 times, 3, 4, 5. I'm now just going to move a little bit farther out. I'm kind of on my shoulders here. 1, 2, 3, 4, 5. I'm going to go back to kind of right next to my neck, just above those collarbones. 1, 2, 3, 4, 5. I'm also lastly here going to kind of get in that little divot behind your collarbone. If you can kind of feel where it drops down there, I'm going to sort of get the pads of my fingers down in that area. I'm just going to do a little bit of pressure. 2, 3, 4, 5. So that's kind of to start things off. And then I'm going to move a little bit farther down into the abdominal area with some diaphragmatic breathing. Diaphragmatic breathing is really helpful. This is one of those things that you should be doing throughout any exercises that you might be doing, especially like resistance training, really helpful. This is something, again, sitting, lying down, make yourself comfortable. What we want to do for diaphragmatic breathing is we want to take a deep breath in through the nose and out through the mouth. But what people tend to do is when they take a deep breath, they tend to go, and you see I brought my shoulders up and then I go like this. Instead of kind of filling the chest for diaphragmatic breathing, we really want to, kind of feel this expansion of the abdominal area. So we really kind of, if we have our hands on our stomach here, when we inhale through our nose, we want to expand the stomach. We want to push those hands out. So let's try breathing in through the nose. Out through the mouth. So you should feel those hands being lifted out and kind of coming back in. What you can also start to do a little bit with that when you start to figure out how to do that diaphragmatic breathing is when you're doing that inhale and expanding the stomach, you can actually give a little bit of resistance with your hands. So let's try that again. Give a little resistance with the hands. The reason we're doing that diaphragmatic breathing and why it's really helpful is because our thoracic duct comes up through the center of our body there. And so it's sort of massaging that thoracic duct, another thing that's going to help stimulate the lymphatic system and bring that fluid back to our heart. And then moving down just a little bit farther, we can do more techniques on our abdominal area. And so we're going to give that same light pressure and we're going to kind of go in 4 quadrants here. And so first to start, I'm either, I'm on my right side, start either on the left or right. You're going to get kind of right above that hip bone that you can feel there. I stack my hands right on top of each other. And I'm going to be doing kind of like a little bit of a scoop technique where I'm going to kind of go like this in toward the center of my body. Not too hard, just a gentle pressure. 2, 3, 4, 5. Now I'm going to move into this other side here, just above sort of that hip bone, just above that kind of hip crease. 2, 3, 4, 5. Now I'm going to move just below. So for me, I can kind of feel my ribs right here. I'm going to move just below that. Again, I'm going to stack my hands. But now when I do it, I'm going to be moving down. So everything, we're kind of moving toward the center of that stomach. So I'm pushing in, again, gentle pressure, 3, 4, 5. And then I'm going to go to that last quadrant here. 1, 2, 3, 4, 5. And then I'm just going to end it right in the middle here. I'm just going to do a little pressure in the middle of the abdominal area. So if you've had lymphedema therapy before, you might have had them do this. So that's just sort of a quick abdominal technique there to stimulate the lymphatics throughout the trunk region. For all of those techniques I did about 5 times. You can certainly do more. That's not going to be harmful. From there, you would move on to regional lymph nodes. And so, especially if your lower extremities are affected, you might start to stimulate the lymphatics in your inguinal region. So that's sort of in the groin region where the top of your leg meets your trunk here. So right in that hip crease. Again, you can stack your hands, make it comfortable, and you're just going to give a little bit of pressure. And I'm doing sort of, again, like a little bit of a scoop technique. You can also do like a little bit of a circle technique here. But we have a group of lymph nodes in that area. So we're starting to stimulate those, prepare to bring lymph up from the lower extremities, if that's the area affected. And if both sides, we can certainly do this other side as well. Not too deep of a pressure, but enough to get those lymph nodes. And then beyond that, there is more drainage techniques that a certified lymphedema therapist would use to help, again, bring that fluid from an affected area to a healthier area or back toward the heart to absorb that fluid. So if you are a patient that's struggling with that, always helpful to see a lymphedema therapist. And then what's also helpful to go beyond, sort of treating this region up here is a pneumatic compression device, which we will talk about coming up. Let me bring this closer again. Perfect. Okay. So this is a pneumatic compression device. This is the FlexiTouch Plus. And so you can see in the bottom picture here that for the FlexiTouch, if a patient needs both lower extremities treated, that is available for this device, as well as the trunk region. So this has narrow chambers that are going to inflate with air and deflate one at a time. And so it's sort of mimicking what we just did with those hands-on techniques, where those chambers inflate and give a little stretch to the skin to help to stimulate that lymphatic system. And so with this device, treatment is going to start proximally, meaning it's going to start at the top in that abdominal region, and it's going to stimulate that area first. And it's going to decongest in that inguinal region, sort of that hip region. And it's going to go down the leg and decongest all those areas and start to stimulate those lymphatics. And then in the second half of treatment, it's going to work from the toes back up to the waist, and it's going to drain that fluid back up toward the heart. Really, really helpful for patients to use this at home so that they can stay consistent with that manual lymph drainage outside of therapy sessions, or maybe you've been discharged and you're kind of on your own. So this is one of those components of treatment. So this doesn't replace any compression garments that your doctor or therapist might have recommended. This is an addition to all of the rest of your therapy. Pressure can be increased or decreased. So if you are a person with lipedema who really has a lot of tenderness to those tissues, you can certainly decrease the pressure with this device. And a lot of patients find it very, very comfortable. And I will just talk about this, and then Dr. Wright, I would be curious to hear you talk about some of the studies that you have done. This is just some feedback that we've had from patients with lipedema and their experiences with the FlexiTouch. And so many of these patients, 82% had improved symptoms, less pain. That's a really big thing I saw in my practice with just doing hands-on manual lymph drainage and seeing patients use pneumatic compression. Even that first time, a lot of patients felt relief. You know, your legs are going to feel a little bit less heavy. So you'll feel more mobile, and you can see 57% had less heaviness and reduced leg swelling. So certainly some patients may have more leg swelling than others. And so certainly some patients might see more leg swelling reduction than others, but it's very, very helpful for these patients. And so Dr. Wright, I'd be really curious to hear what you've been doing for these patients in terms of treatment, including with pneumatic compression, and some of the results that you've seen.
So yeah, so we did a study that was just published in 2022, and it showed the reduced volume. So first we looked at compression alone. Mostly 20 to 30, but some 30 to 40 millimeter mercury compression pantyhose in our lipedema ladies, and they on average got about a 2% decrease in volume by circumference. And then when we combined that with the FlexiTouch pump, they got about double the reduction in volume, so about on average about 4% in the areas we measured. And they also experienced less pain, just like what the patients have reported to you. We also found that in our study that they had less pain, felt less heaviness, and so this is my research is confirms basically the same thing you're sharing here. And so it's nice because sometimes you do these things, and we have more numbers and more we actually looked, we actually measured each the leg at each circumference point, and we actually looked at also bioimpedance, or which is which is this bioimpedance is basically a minute electrical current that goes either through cells or around cells. And so we can measure fluid and interstitial and total fluid, and we found that the interstitial fluid did decrease in our ladies who had with both the compression and the pneumatic pumps. And so we do kind of confirm what we hoped was going on, was that there was decreasing this interstitial volume, in which we talked about a little bit ago, about how that's important because of all the inflammatory markers that sit in that interstitial fluid.
Yeah, absolutely. I think that really this study is just really shows you how important it is for this multi-pronged approach again to treating lipedema and lymphedema for these patients, that it is really important for them to wear compression garments. And like you said, it's going to be variable for each patient. Some patients might need a lower compression level than other patients, but it is really important that they see further benefit in pain, like swelling, that tissue fluid, when they have a way to then move that fluid on a daily basis and then put their compression garments on. What I didn't mention, I guess, earlier when looking at the FlexiTouch is that we recommend that patients use that for 1 hour per day if they were doing the full leg treatment. And so that would be outside of wearing your compression garments. And then, of course, it's important for these patients to do their daily exercise. Like I said earlier, even just walking, like getting your compression garments on and going for a walk is really, really helpful for stimulating the lymphatic system, for helping with a lot of these symptoms and makes it really manageable on a daily basis, because this is, we know it can be tough to manage.
I want to also add, the breathing techniques and the clearing the lymph system up top, and I recommend my patients do that before or after they use their FlexiTouch or whatever pneumatic.
Yeah.
So I do use other pneumatic compression. It really does depend. I mean, obviously, I'm very familiar and love the FlexiTouch. I have the research to show its effectiveness, but there are other ones, and sometimes they're insurers. Honestly, I'm not going to ask if another pump is what is going to be covered by their insurance, then I'm going to go with what's going to be best, what's going to be best for the patient, even if that means best for the patient's pocketbook, because in the end, this can be, we don't want to add financial hardship any more than than there already exists. And then so I do think doing the clearing in the combination with the compression pump and the compression garments.
Yeah, absolutely. That's a really good point. We certainly have patients that, maybe they have a device that ends just at the top of the leg, for example, and doesn't treat that trunk area. And, a lot of times, like you said, insurance dictates that that's what they use. And so really good point that this, treating the terminus, the abdominal techniques, those are really, really great additions to help give that patient a little bit extra in sort of that truncal region, because clearance in that area is so important. So I'm really glad you added that.
Yeah, great. And then always, so I mean, this is a really nice overview. We have the diet, some supplements, some compression. This is really a good management. Yeah. So, a good management overview of how to handle lipedema. And then that sets the stage. Everybody should have this. Now, then there's some that will go on and need surgery, which can have other benefits and will remove some of the tissue, but surgery doesn't cure it, and you need to, no matter what, everybody needs to do this multi-pronged management of lipedema.
Absolutely. Is there anything else you wanted to add before we wrap this up?
No, thank you so
right.
much, Jennifer. This is what a delight and how really helpful your information is.
And thank you for having me.
Thank you very much.